Esophageal atresia is a congenital anomaly seen right away at birth. There are two main types of this. There are 5 types overall, but 2 main types that we see relatively commonly. One type, the most common type, is where there is a gap in the esophagus. So the esophagus is obviously the swallowing tube. When you swallow food, it goes down the esophagus into your stomach. Obviously, if there is a disconnection in the esophagus, people can't eat. The most common type of esophageal atresia is where part of the esophagus is missing, that is, there's a gap in the esophagus, and then there is an abnormal connection between the lower part of the esophagus and the trachea being the tube that brings air to the lungs. So obviously this is bad for 2 reasons. One, babies can't feed, and number 2, there's a connection abnormally between the swallowing tube and the breathing tube, and this can lead to breathing problems as well as the eating problems, and in fact this can be a life-threatening disease. The other and slightly less common type is where there is a gap in the esophagus and there's no connection to the trachea.